At Logan Regional Hospital, we provide care for our new community members and those who have been here for a while. We care for those with the most serious of diseases and those with all types of injuries. And now, our goal is to be an even better community partner by better caring for people's hearts, by providing emergency care, such as balloon angioplasty, top quality heart care for all who need it. That's our hope, our goal, and our plan.
All of us know somebody who has been impacted by heart disease. And if you don't know somebody today, you might know somebody tomorrow. Your loved ones could possibly go through the same experience that mine did. We were celebrating my 50th birthday that day, and we'd been out to dinner. We had gone home and enjoyed some German chocolate cake, and one of the children wasn't interested in that. My husband went to the cupboard to reach for a package of Oreos, and he felt a pain in his shoulder. He was having some nausea, and then he said, "I feel as if there's a vice squeezing my chest." And that's a very classic symptom of a heart attack.
When someone experiences a heart attack, every minute counts. Nothing is more important for the patient than rapid access to care, rapid diagnosis, and rapid treatment to open the closed artery and restore the flow of blood.
When somebody comes to the emergency department with heart attack symptoms, they're in pain and they're often scared. We mobilize a team of people, nurses and physicians, to try to assess the person promptly and provide the pain management necessary, both to make them feel better as well as to help their anxiety levels. There's a deadline, a criteria, where we might have to do intervention with them with very powerful clot-dissolving medicines called thrombolytics, or get them to a heart center within 90 minutes to do intervention that way.
Every year, Cache Valley residents needing emergency interventional heart services are transported from Logan Regional's emergency room by ambulance and helicopter to hospitals in Ogden and Salt Lake.
When a family finds out that they have to be transferred to another facility for intervention for their heart attack, many of them are very confused. They ask the question, why can't I just stay here? We've heard that you're a trauma center and a stroke center. Why can't we just stay here? And we have to explain to them that we don't have interventional cardiologists here.
I called my children on the phone and said, "Dad is having a heart attack. He is going to be transferred to McKay in an ambulance." And that right there produced a great deal of fear and anxiety in my children.
Logan Regional Hospital has the opportunity to expand heart services to include interventional heart procedures.
Interventional cardiology involves balloon treatment of coronary arteries. That's what most people think about. We call it angioplasty or stenting, and it's become a very complex science and practice over the last 10, 20 years. The people that present with acute problems need to be treated by opening that vessel as soon as possible. And there's two basic ways to open the vessel. There's medical therapy, the so-called clot busters that are thrombolytic drugs that actually destroy blood clots. The other way to open that artery would be to pass a catheter down through that obstructed artery into the blood clot, dilate the artery, maybe place a stent in there to help maintain the patency or the openness of the artery, and reestablish blood flow that way.
The plan is to build 2 state-of-the-art, fully digital catheterization labs at Logan Regional. The hospital is also currently working with the Intermountain Medical Group to recruit an interventional cardiologist to work with Logan's existing skilled cardiologists. The total cost of the new heart cath labs is about $3 million. Financial support from the community is critical.
I think it's important that the hospital partner with the community to bring interventional cardiology services to the Valley. Just like with Cancer Center, we were able to raise over $1 million to bring the Cancer Treatment Center to the Valley, and it benefited a lot of individuals and a lot of families and a lot of community members.
Of the $3.2 million needed to fund the new heart cath labs, Intermountain Healthcare will pay $2.8 million if the community can raise $400,000 through the Logan Regional Hospital Foundation's Community Giving Campaign.
Because of the community's generosity, we're able to make the Cancer Treatment Center a reality in Cache Valley. We're hoping for a similar level of support for our interventional cardiology program. Just like cancer, heart disease affects a large number of people in our community. 20 to 30% of the people that we transfer out of our emergency room are transferred out for heart services that we cannot provide at this time. By building this program, we're hoping to be able to serve those patients better.
My family has a history of coronary disease. I went in and did the treadmill test, and after the treadmill test, then we knew that I had a heart problem right on the treadmill. They saw that it was blockage. I had 90% in one artery, 70% in another one, 50% in another. And so then they did give me the ambulance ride down to McKay-D, and then did the surgery that night at like 8 p.m. and went in and put in 5 stents.
Many community residents have voiced a desire to have interventional cardiology services available in Cache Valley. Patients needing these treatments and their family members would no longer have to travel outside the valley.
While I was at McKay-D, my wife did drive back and forth from Smithfield, and the one night she left quite late and got home like 1 in the morning and then returned back to McKay-D by, I believe, 7:30 the next morning. So I was a little concerned about her driving back and forth because it made it a little difficult that she was not getting the sleep that she should get properly, and I was concerned for her safety.
My husband is very close to his children, and when he ended up being transferred to a facility out of the county, that meant that he could not see his children on a regular basis. He couldn't comfort them personally. He couldn't hug them. He couldn't have them at the bedside to reassure himself and them that everything was going to be okay.
I put myself in the patient's shoes or in the family member's shoes, and I picture that ambulance door closing or the life flight helicopter taking off after a patient comes to the emergency room and is diagnosed with having a heart problem and they need to be flown to another hospital. And I worry about those feelings that they have. And it's difficult sometimes for the hospital to bring a lot of new services because it takes a certain amount of disease, let's say, in order to have a quality program, to have enough of these procedures in order for a physician to be skillful at them. And we feel that we're at that position where we can now expand and include this service for the community.
I believe that having the ability to put in stents here locally would just make things easier on their families, make things easier on the patient. And I think anything to try to help their own local hospital grow and be representative to take care of any of the needs is just going to strengthen the community.
For us to increase our ability to help people, to be able to provide better care for them, complete care, so that they don't have to travel, so that we can stay here in our homes and take care of our family here, is very important to me.
We have one goal: top quality heart services here in the Valley. With your help and the help of other community members, we can reach that goal. It'll mean better care and help us be a better community partner.